Welcome everybody. I'm Dr. Rohan Palshetkar. I'm a practicing gynecologist from Mumbai. Look, we're going to be talking about preconception counseling today. It's a neglected aspect in all couples who are trying to conceive. Today, we're going to be taking a deep dive into this. Today, I'm having a conversation with Dr. Apurva Palam Reddy from Bangalore and Dr. Tanushree Pandey, a gynecologist from Mumbai. Let's just go straight into the questions and see what the aspects that are neglected when it comes to preconceptional counseling. Tanushree, I want to ask you, and I know this is always going to be a bit of a dilemma, but when patients are trying to get pregnant, do you think that they need to visit a gynecologist to plan a pregnancy?
Right. So I think this is going to be the gist of why we are here. So if there is something in the family, and if we want to screen you more, something very basic I'll talk about. Your mother has hypertension, or your sister got hypertension during pregnancy, or there's a thyroid history in the family. This just gives your doctor and you a heads up. We are going to be more careful with your screening. We are going to screen you more frequently. Even after you get pregnant, if a low risk patient I call once in a month, maybe I'll call once in 2 weeks so that I can be more vigilant and give you proper treatment at the right time. Because once it gets blown out, it's very difficult to get it back in control. Other than that, if there are smaller problems, smaller things like, vaginismus, I think so many of you listening to this are facing it or have faced it. You're having difficulty in having sex. Now you're having difficulty in having sex, you want to get pregnant. So you and your partner start fighting because now sex is only not happening. How will pregnancy happen? When that doesn't happen, the stress goes up because there are fights every day in the family. There are fights between you and your partner. When the stress goes up, and even if you end up having sex, the quality and everything, the stress index, the oxidative stress will be so high, you will not land up in pregnancy. So instead of this, break the vicious circle, come and meet your doctor. See, even if we ask you these questions, why are we here today? To explain it to you. None of these questions are judgment based. None of these questions are for us to sort of sit and judge you, even if it's a higher BMI. I know today for us doctors, it is so difficult to even say this one sentence to the patient that, maybe you need to cut down a little on your calories or start exercising, because these days we've become extremely sensitive and somehow very it's become reversed now on the doctor that, that doctor is very judgmental. But that's not true. Even if you come to us, we will counsel you, we will give you remedies, and trust me, we'll hold your hand and walk you through the process. Even if you can't lose that weight, even if you cannot control the things we've asked you to, we'll still come up with a solution. But we have to be in your journey from day one, start, that is before pregnancy.
So Apurva, we've got couples coming to us trying to get pregnant. What are the tests you ask them to do when they're trying to get pregnant? Are tests compulsory?
There are just 3 simple tests. One, ultrasonography for the women, pelvic sonography, preferably a transvaginal one, so that we understand how the uterus, ovary are, and in case if she's ovulating on a regular basis. A semen analysis for the husband, that is a must. As Tanu just mentioned, it's 50% onus is on the partner, and it's extremely important. We can't stress it enough. Having a regular sexual life or having a good erection is not a manifestation of having healthy sperms. So it is absolutely imperative that they go ahead and get a semen analysis done. Now, the third test that I would kind of honestly recommend for everyone also is getting a fallopian tube testing done. It is a little invasive, but this is one factor wherein I think you have a higher chances of conceiving naturally if you get a fallopian tube testing done a little earlier when you are planning for pregnancy as compared to planning it later. And especially more so if you have abdominal pain during your periods, or if you have shorter cycles, then yes, your doctor can take a decision on any additional tests. But I think these 3 tests are definitely a good way to start off your fertility journey.
See, we always talk about the woman when we're talking about getting pregnant. But Tanushree, I want to ask you, what about the husband? What about the man? Is there an important role for the man to play a role in getting pregnant? Does the husband's health matter when you're trying to get pregnant? How important is the sperm factor when it goes to getting pregnant? Let me hear your thoughts on that.
Yes. So I don't know whether the males will be happy to listen to this or not, but you also have the onus till the time your partner doesn't get pregnant. And of course, after that, emotionally as well. But jokes apart, it is extremely important, A, for the male partner to get screened, B, for him to quit or reduce smoking. Smoking, you should ideally quit, at least while you're trying to get pregnant. Alcohol consumption and other addictions, reduce it. All these things, because they directly affect the semen or the sperm quality and count. And thirdly, if you've been somebody who's been already trying from 6 months to 1 year, you should go in with your female partner and get yourself screened as well. Because in India, still, I think the whole concept of the man cannot have a shortcoming, it's so pertinent that they're just scared. I think we only talk about the insecurities of females, but I think males are also so insecure that what if my count comes low, or what if there's a problem? Look, we have solutions today. Science has come out so far that, like Rohan mentioned, that there are other methods in which we can help you get pregnant, provided you reach us at the right time. So before pregnancy, come get yourself screened. Your thyroid, your blood sugars, they are also important and they affect your fertility index. So get yourself screened, take proper medication so that your stress doesn't go up and then further decreases the chances of pregnancy.
We always are worried about our family health. How important is family health when a patient's trying to get pregnant? Do you generally ask the patient about their family health history when they're trying to conceive?
So the first thing, of course, what we ask is, are you married in relations? And when we ask that, what we are asking is not if you're wife and husband, but if you were actually relatives before you got married. And in case if there is any history of abnormalities or genetic variations, these are the aspects that are extremely important. There are situations wherein the brother's kids had abnormalities which were detected. And with that, we were able to kind of detect and prevent an abnormality in the younger brother's children. So please do not take it for granted. In case, again, there is absolutely no taboo on that. If there are any abnormalities in the family, someone has been through abortions, there has been delay in getting pregnancy, do let your doctor know, because that might definitely add value in your fertility journey as well.
So couples are always happy when they see those two lines on that urine pregnancy test. Tanushri, I want to ask you, should couples come immediately once they know that they're pregnant, or should they wait and come aram se?
Okay, so thank you for asking me this question, because now what will happen is, as soon as the pregnancy test comes positive and you go and you tell some elder person in your family, they'll be like, very good. Now we will not go and visit the doctor till the time it is time for your either 8 weeks or first trimester scan. Look, I'm not even trying to sort of jeopardize what they are saying, because they come from a school of thought where at that time, going to a gynecologist was a privilege. You could not easily go. You lived in villages where there used to be one doctor. You had to walk 10 kilometers and reach the doctor. Today, unfortunately or fortunately, there's one gynecologist sitting every 4 blocks away. So please don't hesitate in coming to us immediately as soon as the test comes positive. I will explain why. Because these days, because of the stress levels, because of the coexisting conditions, also the work life. Look, when our mothers or grandmothers felt nauseous when they were pregnant, it was okay. I mean, because the day was a little slower, they could afford to puke 4 5 times and yet continue with their work. All the medicines weren't so good, so they were just told, Abhi, you manage it. That's how pregnancy is. Today we have medication. So if you're nauseous, if you're throwing up, you have to go attend that meeting at 10 o'clock. We have remedies which can solve that nausea, vomiting, and lead to a very nice, healthy, normal pregnancy. So I'm not even going ahead with complications, very basic things. Your nausea, your tiredness, your fatigue, all these things, or whether your heartbeat of the baby is come or not, the baby is properly in the uterus or not. All these things we can check as early as 5 or 6 weeks, which is as soon as your UPT comes positive, your pregnancy test comes positive. So please come and meet us immediately. We will not do anything that will hamper your pregnancy. We'll only help you out.
Once the patient's pregnant, the mother and the father are concerned about the health of the baby. So Tanushri and Apurva, I want to ask both of y'all, because this is going to be a long answer, I'm sure. What can we do to ensure that the baby's health is good throughout the pregnancy and they have a safe delivery?
Yeah, I think regular visits, when you're visiting your consultant, your gynecologist, they will let you know when your next checkup is. Make sure that you do not miss those checkups. Proper investigation. We are in that day and era wherein we can afford really good investigations in order to understand abnormalities in the babies and detect it even before they are born. So make sure you don't miss those important investigations like your NT scan at third month or your anomaly scan at your fifth month. And thirdly, I think your supplements. I know as much as people would want to, hate taking medications or taking pills. It is you are growing another human inside you. So you definitely need some amount of additional support, and having the right kind of supplements is extremely important.
So I'll just continue with where Apurva has finished. So for those of you who are listening, when we say supplements and when we want your hemoglobin to be a certain level, not only are we worried about your delivery, which will happen 9 months later, please know that anemia is the most common reason for preterm birth in India. So just you come to us and you're like, no. If I don't take these supplements, as long as my baby is growing fine, I'm okay. We'll figure it out. We'll take injections. We'll take blood later on. I can't take these medicines. They give me constipation. They give me diarrhea. They leave a metallic taste in my mouth. I know it's horrible sometimes, and for most of our patients to take all these supplements, you have to do it for your baby as well, is what we want to tell you. And then, secondly, most important, I'm bringing it now. I don't know, most of you are going to laugh on this. Don't do Google if you want to have a healthy pregnancy. Because these days is literally when I'm sitting down writing the anomaly scan, the patient will sit and she'll be like, you're doing it at 19 weeks? Google told me I should do it at 21 weeks. Now, Google doesn't know about ranges. Why am I doing it at what week? What quadruple marker test has to be done? Please don't Google symptoms of pregnancy, investigations of pregnancy, when is the right time to deliver, when is the wrong time to deliver. Trust your gynecologist, and that's why we are again and again insisting that preconceptionally you go to your gynac so that you form that bond with her. See, if you come to me in the 9th month of your pregnancy, you will not have trust on me 100%. That is just human nature. So give me and you both time to grow in that pregnancy and settle in that pregnancy together. Come preconceptionally, and trust me, when you visit your gynecologist enough and she or he guides you through it, you will know how to sort of monitor your pregnancy. And if at any point we see any high risk, moderate risk, anything where we need intervention, we as doctors, we don't do smooth talking or just empty popcorn promises. We will tell you where the problem is, try to solve it, and take necessary steps for it.
So I hope you guys had a good podcast and you got some good take home messages with it. So Dr. Tanushri and I are here, and I think if there are any questions, we would love to take them. Tanushri, let me get this first question out to you. Which side should I sleep? Right side or left side? Do you have
Okay,
any
this
take on that?
right. So I think most of us do keep recommending the left side because of the prominent vessels being on that side. However, having that said, enough research has shown either sides is okay, and especially in the second and the third trimester. The first trimester, when you're easing into pregnancy, don't be so bothered about which side because your tummy is not grown that much. There's nothing being compressed. However, on the second and the third trimester, sleeping on either the left side or the right side, you can use U pillows, you can use pregnancy pillows, and either side is okay, but sleeping on one side is preferable.
I think Tanushri, what you said was perfect. So Sunil Mane is asking, what are the essential prenatal vitamins and supplements a mother should take during pregnancy? So I'll just want to cover that. When we look at prenatal vitamins and supplements,
Look, we are considering folic acid to be one of the most common prenatal supplements which we do consider to be given to a mother, because India, if you go to see, has one of the highest neural tube defects, basically the problem with the baby's brain and the spine. And this is simple by taking folic acid tablets. In fact, it's one of the safest tablets in pregnancy to take. And then there are multiple micronutrients which you get from your vegetables and all. But then these micronutrients which you get from your vegetables and all, you have to have a massive amount of those vegetables. So when we do give you medication to take, it contains these micronutrients which are essential for planning your pregnancy as well. So we've got another question. What exercises are safe and beneficial for the mother during pregnancy? Tanu, would you like to take
Yeah,
that?
yeah. So, see, first and foremost, we always try to tell our patients do the same amount of physical activity that you were used to pre-pregnancy. So sometimes what happens is we have patients who've absolutely done no form of exercise and suddenly want to start lifting weights or start doing extremely heavy form of yoga. That I would not suggest you must do. Yes, 30 minutes of walking after your lunch and dinner is totally advisable, unless and until, of course, you have some high risk wherein your placenta is low or you're at risk for a preterm birth or something like that, and you've been asked not to exercise. Other than that, 30 minutes of walk after lunch and dinner is good. Once you hit your third trimester, there are, of course, certain exercises which are recommended in your prenatal sessions, where again, I strongly recommend you take professional help and don't try to do them yourself, because these are called as isotropic exercises, which basically make sure that you don't pull some kind of a muscle, you don't injure something, you don't cause any form of harm to yourself or your baby during your pregnancy. So, to sum it up, exercise is necessary, important, and a must during pregnancy. What form will totally depend on what was your physical activity level before you conceived. So you can totally lift weights also in pregnancy if you were lifting weights before and your pregnancy is not at high risk. But you can't suddenly start doing it because your body is coping up. Somebody will feel more tired, somebody will feel less tired. So always take a nutritionist, a physical therapist or your trainer into confidence, and of course your gynecologist, and they can then be curated plans as per the patient's requirements.
Tanushi, I'm so glad you talked about the fact that the weights, if you're lifting weights and things like that prior to your pregnancy, you can still continue. Anshika Singh is asking, if I am overweight, do I need to reduce my weight? If you're looking at it at a pre-pregnancy point of view, definitely it would help with your entire 9 months of pregnancy as well, and it would help you conceive as well. But in once you know that you're pregnant, you cannot do a diet to lose weight during your pregnancy. But at the same time, we don't want you to eat excessively as well during your pregnancy so that you put on too much weight. What we look at during pregnancy is somewhere between 8 to 12 kgs for a mother to gain. And what our primary goal is to ensure that the child is getting adequate nutrition. So, as Tanushi said with the previous question, we would like you to consult with a nutritionist in coordination with your gynecologist so as to ensure that what is the adequate amount of nutrition for you as well as your baby to grow well and healthy throughout the 9 months. Shivani Maheshwari is asking, is preconception counseling only for women? Tanushri, I'd love for you to take this.
Absolutely not, and it's always for the couple. And I'll give you a few reasons, other than the fact that, of course, the husband should be there in the journey and should be there emotionally and mentally and be involved in the pregnancy. Preconceptionally, we always, especially these days when subfertility has increased so much, and wherein we are planning for families at a much later age. So, planning for your first child at around 35 years has become a very general norm. It's normal these days. So in these conditions, we want to screen you earlier. And I think Rohan's reel came out today only, or his talk, that 50% of subfertility goes to men these days, and they are responsible for 50%. I mean, the sperm comes from them. So you have to come in with your wife. You have to be there from the first session so that we can screen you as well, give you supplements if required. If you're smoking, help you quit that, control your drinking, and give you other such counseling which will help you conceive faster.
Tanushri, I really like the fact about the point where you said that smoking is something that we do have to talk to the couples. It's not just the woman who needs to quit, it's also the man. Also understand that there is something known as third hand smoke as well. So that is a concept which basically means that if you're smoking and you come smoke only outside the house, it's still on your clothes. So it's always advisable to wash that off and all. And that ensures that the pregnant mother, even if you're trying to conceive, there's no cross contamination. That's all. Agastya Singh's asking, is it too late to get pregnant at 40? What can be done? Well, at the age of 40, you are going to have lesser chances of getting pregnant. It's not that you are not going to get pregnant. Age is the biggest factor. So, generally, when a couple is trying at the age of 40, we always ask them that you need to visit your gynecologist within 3 to 6 months of trying if you're not getting pregnant, because sometimes you may require some assistance in terms of either counseling, in terms of treatment of IVF or even IUI, and that will help you get pregnant faster. Because at the age of 40, we are also concerned about the 9 months of pregnancy, not just about getting pregnant. Because once you're pregnant at the age of 40, you have a higher risk of diabetes, higher risk of hypertension. So we want to try and get you pregnant as early as possible. So to just answer that question, at the age of 40, it's not too late to get pregnant, but the chances are a little bit more difficult. Okay. Tanushree, Amiya is asking, what is preeclampsia complication during pregnancy and what are the possible causes and treatment?
Okay, so in layman term, preeclampsia basically is a spectrum. It has number of things. One of the things that it has is your BP gets raised, your blood pressure gets raised. Now, it can happen because maybe you had hypertension before, or maybe you never had hypertension and you developed it for the first time during pregnancy. Now, what happens because of this is, in short, because this is, we have chapters and chapters on this, we can go on and on about it. But in short, when your blood pressure rises, the blood to the baby decreases. So basically, your baby stops getting the blood that the baby should get. And when your blood pressure rises, you become more prone to something known as eclampsia, which is seizures, where you get fits during pregnancy. And if that happens, there's a very high mortality and morbidity rate, especially for the fetus as well as for the mother. So if you've been screened positive for preeclampsia, now these days there are a lot of first trimester scans that give you screen positive, uterine artery Doppler. Don't panic. Even if you've screened positive for preeclampsia, we might add certain medications. We'll ask you to continue with your walks. Exercise becomes very important, and keep your blood pressure under close monitoring. And with good medication, good control, and
Yeah, I think we just lost you this, but okay. Anshika Singh's asking, what are the do's and don'ts during the first month? I think that's going to be a very difficult answer to for me to cover alone. I'm going to ask Tanushri also to chime in with me on this. But personally speaking, if you have had a pregnancy that's there are no per se do's and don'ts in your first trimester, except that maybe try not to lift too much heavy weights. Try and maintain your regular exercise. A definite don't is bed rest, unless your gynecologist has told you. So just ensure about the fact that you just carry on. You may experience a little bit of nausea and vomiting. So speak to your gynecologist before you take any medications. Don't do any over the counter pills by reading on Google, as Tanushri has said during her podcast. That makes it a little bit more complicated. Tanushri, would you like to add on a few things?
Yeah, I think since like Rohan rightly said that, everybody faces some amount of nausea. It'll vary from patient to patient. So try to have small meals, keep your nutrition, so keep your protein high, have some amount of carbohydrate, fats, like Rohan very rightly said. Don't try to lose the weight now. You can maintain the weight, gain least if you come into the higher BMI, maybe 8 kgs is going to be enough for you. So you'll have to eat small amounts every 2 to 3 hours. Try to make healthier choices. Don't starve, don't stay hungry. Walking, exercise. Something that I want to cover, because I think patients hesitate in asking this, is that are you allowed to keep relations with your partner? Are you allowed to have sex with your partner when you're pregnant? I personally, I think we all differ in opinions, but I personally, till the time we don't have the placenta localized, which genuinely happens during the NT scan, I try to tell them first trimester, you might want to avoid it because as it is, there are very high chances of spotting, bleeding, and you will get very anxious that are you headed for an abortion. From your second trimester, once everything is low risk, your placenta is up above, there's no high preterm labor or anything, we will give you a heads up for that as well. And like Rohan said, the list is endless. So then, of course, you'll have to come to us for a consult after this.
Okay, Binay is asking, what about comorbidities like TB, diabetes, hypertension? Which time can visit? I think what he means is during either pre-pregnancy or post-pregnancy, is there an issue? Like, can any of these conditions actually happen? Tanu, would you like to take that?
Okay, so I think, see, for tuberculosis, obviously, you will have to visit whenever you show symptoms, or we'll screen you most probably before pregnancy because tuberculosis also leads to subfertility or infertility. So we are going to probably screen you. If you're already on the tuberculosis medicine, first 2 months you cannot conceive. The next 4 months, there are now alternative drugs that have come which allow you to conceive, and you can take those medicines even during while you're pregnant. About diabetes and hypertension, we cannot emphasize enough about pre-pregnancy counseling. So if you do come to us pre-pregnancy, we might give you certain lifestyle modifications, diet charts to control your diabetes, hypertension, and reduce the excessive weight if need be. Once you are pregnant, then of course we will try to control it as much. And post pregnancy also, at least till 6 weeks, we always keep a tab because after 6 weeks, there are a lot of changes in the dosages that come, whether it's thyroid, whether it's BP, whether it's sugar. So yes, I think it's a full journey from pre-pregnancy, during pregnancy, and post-pregnancy.
Absolutely. In fact, just the question what we want to cover before that was that when you are talking about diabetes and hypertension, every time you go to a gynecologist clinic, your blood pressure is going to be taken, and you're also going to be screened for diabetes once every 3 months to ensure that you're not at a high risk. Okay, Shivani says, I love my Starbucks coffee every day. Can't do without it. I'm trying to have a baby. I'm already 35. Do you think I should curtail it to improve my chances of pregnancy? Okay, Shivani, this is going to be again a question that is going to have a couple of thoughts on this. Honestly, you're allowed around 300 milligrams of caffeine per day, irrespective whether you're pregnant or not pregnant. So, one cup of coffee is absolutely fine. It's not really going to affect your chances of getting pregnant. However, if you are someone who loves Starbucks coffee 4 to 5 times a day, then definitely no. I know Tanushri and I have a couple of bad habits of drinking 2 to 3 cups of coffee per day. But I would advise that if you do want your 1 cup of Starbucks coffee, that's absolutely fine. You just don't go overboard with the coffee. That's all. Uh,
Absolutely.
yeah. Tanushri, Kirti Kulkarni is asking, after conception, if I get sick and have to take antibiotics, will it affect my
Hmm.
baby?
So you have categories of drugs, Kirti, and we will only and only give you those antibiotics which are safe in pregnancy. So we all as gynecologists are well aware of the drug list, and that is why it's very important to consult your gynac, a specialist. In fact, whichever specialist you go to, they will always ask you to go back to your gynac and take a thumbs up on whether this is pregnancy safe or not. So don't worry about that at all. As long as you've gone to the right, like a educated, specialized doctor, you will not get any medication that is not baby friendly.
Absolutely. Firstly, I want to thank all the people who are sending us such warm comments in the
Yeah,
box
yeah.
saying thank you, good information. I'm glad this is helpful. And I must say, Ready to Be Mom Doctors podcast is really a good initiative brought up. And this is really helping us get out there and dispel the information to everyone who's logging in. So we're still getting a lot of comments on the information thanking us. Okay, so
Yes.
we've got, is it okay to walk a lot while trying to conceive? Again,
Hmm.
I think if you're trying to get pregnant, it's fine. I don't think, and if you're used to it, I think Tanushi said that very beautifully in a previous question that if you're someone who's used to doing regular exercise, working out, and everything, I don't think it should be an issue. Tanushi, do you want to add anything?
Yeah, no, like we've been discussing, that is relative. So when you are saying walk a lot, now for me, walking a lot might be 5 kilometers. For you, walking a lot must be 500 meters. So I think it's very relative, and hence whatever you are used to. And that's where, I'm sorry, I've been reiterating this over and over again, but that's where prenatal counseling or pre-pregnancy counseling comes into the picture, because these are questions that we will address to you at an individual level and tell you that, okay, if you're used to 30 minutes of walk, please continue it. So things like that.
Absolutely. Absolutely, Dhanushi. I think that's a fantastic point. I'm loving all the happy messages that we're getting it. Okay, Seema Singh says, how do pregnancy symptoms start? Again, this is going to be different from each and every person, but one common symptom which everyone will have is that you'll miss your period. That is one
Yes.
thing which is common with any woman who's absolutely getting pregnant. Other symptoms are highly relative and subjective, which are going to be different from each couple, where you're going to have nausea, you're going to have breast tenderness, you're going to feel lethargic, tired, sleepy. So all this is going to be extremely relative. Personally, when my wife was pregnant, she didn't have any vomiting or anything like that. She just used to feel tired and sleepy. So that's something that's highly relative to her. Well, I have certain couples who come to us who are pregnant who have no tiredness, they just have vomiting. And there are certain patients who only have absence of periods and no other symptoms. Those are the luckiest patients who are pregnant, who are not suffering through the first trimester symptoms. Tanushi, anything that you want to add to that? Or I think we
No, I think we've tried to cover everything, and I'm sure we'll be doing these sessions more often, and we'll always look forward to asking more questions and solving more queries.
absolutely.